Hospital organization. So there are many levels within healthcare, and hospitals are no different. So there are fiscal and information services. So those are the people that are going to be responsible for admissions of patients, keeping medical records up to date and safe, billing for those services, accounting, and any other financial aspects. And then you have your support services, and these are the ones that are responsible for all aspects of the physical plant and facility. So sometimes you have your maintenance and things like that. Nursing is responsible for direct patient care, and then you have your professional services, which are your healthcare personnel that provide services at the request of a licensed practitioner who help aid in the patient diagnosis and the treatment of patients. What oversees all of these four branches is the hospital administration. Generally, each branch is headed by an assistant administrator or a director level. And human resources, they kind of fit into a weird category, but they can be part of fiscal and information services as well. So support services, like mentioned earlier, they are responsible for all areas of the physical plant or the hospital. And that includes cleaning, any maintenance that needs to be done, security, making sure the facility is safe, food service, making sure we give our patients food, and purchasing of all of our supplies that we use in the hospital because there are a lot of them. Nursing services. The personnel in this service, as most of you probably know, nurses provide direct patient care, and the personnel in nursing services is going to vary depending on the education that they have received and the training that they have received. So there are some examples in that. So an RN is a registered nurse, and that's usually a 2-year associate degree. Then you have an LPN, which is a licensed practical nurse, a CNA, which is a certified nursing assistant. You have your patient care techs, and then you also have ward clerks or a unit secretary, and those are the people that are usually there, tending to patient families' requests, answering phones, just kind of helping out where needed. Nursing staff will be divided onto different floors or service areas within the hospital. So look at your emergency room, operating room, your intensive care unit or your ICU, cardiac care unit, the nursery, maternity, pediatrics. Each of those levels, each of those floors need nursing in there. Some service areas may have their own phlebotomist, so it just kind of depends on where you end up working, but they may have each floor may have their own phlebotomist. I know a lot of local hospitals just have the phlebotomist working in the lab, and then they go to any area of the hospital. For professional services, this is where essentially, each area is going to provide its own unique service that is going to help to assist the physician in diagnosing and treating that patient. So examples of this would be the clinical laboratory. So we are the ones in the lab, getting those samples down there as phlebotomists, and then as your medical lab scientists or medical lab technicians, these are the people who are going to be actually running these lab tests and providing these test results to providers and physicians so we can help diagnose and treat that patient. Pharmacy is another example. Same with radiology and respiratory therapy. Cardiac catheterization. So this treats patients with a cardiovascular disease, and it does that by inserting devices into the bloodstream, and these devices are threaded to the heart. The clinical laboratory, as mentioned before, this is a service area that will analyze patient samples, and we analyze all types of patient samples from blood, urine, any other bodily fluid such as you have your peritoneal fluid, a CT fluid, things like that. We're going to be looking at cells or tissues, and this helps to make a diagnosis, monitor treatment, or determine a patient's prognosis. Nuclear medicine, so this service area uses radioisotopes to perform tests and treat diseases. The radioisotopes are used as tracers that are injected into the patient's bloodstream. From there, they are tracked to reveal the structure and function of internal organs. Radioisotopes are unstable forms of certain elements that can be detected as they break down, so that's kind of how they can see what's going on. Occupational therapy, so this service area helps to assess patients and designs adaptive aids or compensatory strategies to help perform tasks of daily living. So helps each patient reach their maximum potential. Sometimes this is, as patients get older, they're not able to do the things they were able to do. Maybe they had a traumatic accident and they need some help getting back to, what is normal or what is their new normal. Pharmacy, I'm sure as most of you know, they help to prepare and dispense drugs that have been prescribed by the attending doctor. This area aids the physician in monitoring levels of certain medications to make sure that a patient is on the most effective dose with the lowest amount of toxicity. So they help to make sure that we aren't, physicians at least, aren't giving incorrect dosage or too much of a dose of medication. They're getting just the right amount to do what they need to do depending on what they're trying to do with their patient. Physical therapy. So this service assesses patients before and after treatment. The physical therapist usually will design a program or have other treatments to help aid the patient in rehabilitation. These can include exercises, stretching, and others that are designed to help patients rehabilitate after an injury or illness. Radiation therapy is used to treat cancer, so they use X-rays or other high-energy radiation sources to help destroy those tumors. Radiology or medical imaging interprets a range of diagnostic and therapeutic procedures, and it does that by using various forms of radiant energy. The radiologic technologist will obtain radiographs, computed tomography or CT scans, magnetic resonance imaging or MRI scans. They can do positron emission tomography or PET scans, and they can also use fluoroscopy images. Respiratory therapy, this helps patients to have treatment for respiratory disorders. So respiratory therapists often perform arterial punctures for the determination of arterial blood gas measurements. This will really just depend on the facility and where you're working. Some places have the respiratory therapist do those arterial blood collection, and some places they have the phlebotomist do it. So it's going to depend on where you end up. The laboratory personnel. So these will vary just like nursing on training and education. So usually the supervisor of the lab or the lab director is a pathologist. So this is a physician who went through med school and they have specialized in training in the laboratory analysis of tissues and fluids. From there's usually a laboratory manager and they direct the administrative functions of the laboratory. In larger laboratories, the laboratory manager's duties may be divided into administrative and technical positions. Section supervisors are the next level, and that would be where they monitor personnel, equipment, maintenance, and test results. This is generally going to be a medical laboratory scientist, and the medical laboratory scientist has a Bachelor of Science degree in clinical lab science or medical laboratory scientist. It just kind of depends on where you're at and what they call it. And then there's also medical laboratory technicians, and these are the personnel who have a 2-year associate's degree. Both of these can run routine testing, perform equipment maintenance, and collect specimens. And then after this, we have our clinical lab technologist or medical technologist. So this is kind of the same as your medical lab scientist or your medical lab technicians, and they must obtain certification from a nationally recognized agency such as ASCP. And then the MLS does lab testing and equipment maintenance and can also collect specimens. Anatomical surgical pathology area. So cytogenetics section examines chromosomes for evidence of genetic disease. An example of this would be Down syndrome. Cytopathology section it processes and stains cells present in body fluids or tissues. An example of a cytopathology test is the Pap smear. Cytopathology examines the cells for the presence of cancer or other diseases. Histology, that section prepares tissues from an autopsy, surgery, or biopsy. And they prepare them for the microscopic examination by the pathologist to examine. So the histotech or the histotechnologist actually is the one that kind of helps prepare the tissues. And then the pathologist is the one that will actually, look under the microscope or do a gross examination of that sample. There are special stains that are used to highlight certain cell morphologies. For clinical pathology areas, so in most laboratories that you will work, especially in a hospital, there are going to be these sections. So we have blood banking or immunohematology, chemistry, specimen processing, coagulation and hemostasis, hematology, flow cytometry, and microbiology. Not all labs will have all sections, and some of these sections may be combined. So again, it's just going to kind of depend on where you're working and how they have things organized. Another sections that could be within your lab that you are working is going to be molecular diagnostics, serology or immunology, urinalysis or clinical microscopy, phlebotomy, and then referrals. So blood bank or immunohematology, this is the section of the lab that deals with blood for transfusions. So they will identify the blood type of both patient and the donor. And then from there, they're going to do compatibility testing, and that just makes sure that the blood is compatible for the patient who's going to be receiving that blood. Patients can donate their own blood for use for later, and that is called autologous. And then there are components of the blood, which we talked about before. You have your plasma, your red blood cells, things like that. So within the blood bank, we call it packed cells, which is your red blood cells. Fresh frozen plasma, which is exactly what it says. It is frozen plasma. Platelets, and then cryoprecipitates. Chemistry, this department performs tests on chemical components of the blood. So think about glucose, potassium, check in on your cardiac enzymes to make sure, they're not having a heart attack, your kidney, your liver. It can kind of test out all of these things, make sure everything is working how it's supposed to be. They can also do toxicology, which will analyze plasma for drugs or poison. Immunochemistry, which actually is used to detect antibodies, to detect a range of substances in the blood. And then also electrophoresis. That helps to separate components based on electrical charge. This is most often used to analyze hemoglobin, enzymes, and other proteins when they're looking for certain diseases. Specimen processing. So this is the area of the lab where you, especially as a phlebotomist, may be assigned to. So specimen processing is basically you're getting all the samples and then you're divvying them up, putting them where they're supposed to be, processing, so as far as centrifuging if needed, and things like that. So that is kind of where your specimen processing department is going to do. So there are different things that you need to remember. So a serum collected in a tube without anticoagulants or a serum separator tube needs to be sat out like in a rack for tubes for about 45 to 60 minutes for that clot to form. Serum is usually going to be a clear, pale, or yellow fluid, and the color is going to depend on the patient's condition and the collection technique. Coagulation and hemostasis. So coagulation test is performed on plasma, and that is usually on a light blue tube that contains an anticoagulant citrate. The test performed to monitor anticoagulant therapies. We use this on patients who have had strokes, heart attacks, and thrombophlebitis. Drugs to prevent formation of clots can also help to avoid recurrence of stroke, so we may do a test on that as well to make sure they are getting the correct dosage of that drug. Hematology. This section analyzes blood for diseases that can affect the blood-forming tissues and cells that are produced by those tissues. So examples of that would be anemia and leukemia. Common tests, we would do a CBC or a complete blood count. And then flow cytometry can also be done, and this helps to identify cellular markers on white blood cells. So going back to the CBC, this test includes, it's like a panel. So it includes it's not just one test. It has the hemoglobin, hematocrit, white blood cell count, red blood cell count, and platelet count. It may also include a white blood cell differential, or a diff, sometimes it is called. And what that means is we are looking under the microscope, or the analyzer is reading it for us, and it's differentiating the different types of white blood cells. So if you remember back when we talked in the previous lectures about the different types of white blood cells, you have neutrophils, lymphocytes, monocytes, eosinophils, and basophils. So we would be able to differentiate those and give that count to the physician for patient therapy or treatment. Microbiology, this is the section that will actually isolate and help to identify a pathogenic microorganism in patient samples. We have a lot of different samples that can come through in microbiology. And an example, blood, urine, sputum, feces, any other bodily fluids, essentially we can do cultures on as well. Pathogens are organisms that are capable of causing a disease. So these guys in microbiology are responsible for infection control, or at least usually play a part of infection control within the healthcare facility. The most common tests in microbiology are going to be your culture and sensitivity tests. So we're going to culture whatever that sample is and see what grows. And then if something grows, we're going to check its sensitivity to antibiotics. And then we will let the physician know what they should use to help treat the patient. Microbiology has different sections within it, and that can include bacteriology, parasitology, and virology. Serology or immunology department. So this department evaluates a patient's immune system through the detection of antibodies. Antibodies are formed in response to bacteria, fungi, parasites, or viruses. Antibodies are proteins that help fight infection by binding to surface molecules of the infective agent called antigens. These common tests that we run in this department are the HIV, or the human immunodeficiency virus antibody, and the HBV, which is the hepatitis B virus antibody. The urinalysis and clinical microscopy department. So this is where urine is examined to assess kidney disease and metabolic disorders that alter levels of substances. Many urine tests are done with plastic dipsticks with pads embedded for reagents. Feces can be tested for blood in this department as well, and urine sediment is examined microscopically for parasites. We also can look microscopically for white blood cells, red blood cells. There are things called cast. There are also other cells that we could be looking for to indicate the person's kidney function and making sure that it's, doing what it's supposed to be doing. Phlebotomy. All right, so this is the department where they are collecting blood samples from inpatients and outpatients. They are also responsible for proper handling and timely delivery of samples. So there are different facilities that use phlebotomy in different ways. So make sure that as you learn new skills, that there is a competency check sheet in your file to document training on your new skills so that you are not opening yourself up to any liability. So you want to make sure if you learn something that you are being, checked off on a training sheet for that. And that just proves that you were trained and shown how to do it appropriately. Referrals, this section processes and ships specimens for any tests that we don't perform in the laboratory locally. So this would be sending out to a big reference lab like Quest or LabCorp. Some of these tests may be new or for research purposes only. And physicians can call the referral department to request information on uncommon tests. So sometimes in the lab you'll get a phone call and it'll be a provider or a physician wanting to do, a test that just isn't really performed very often. And then that is then our responsibility to look up, the requirements for that test. What do we draw it in? Does the patient need any special preparations? Where does it go after it's drawn? Does it need to be frozen? Things like that. So when those happen, because they do happen, you would need to, figure out who you need to call and get all the information you need. Molecular diagnostics, they use can diagnose genetic disorders, analyze forensic evidence, track diseases, and identify microbiologic pathogens. A lot of times this is used to identify HIV and genetic diseases like cystic fibrosis. For molecular diagnosis or diagnostics departments, there are special tubes and handling procedures that can be required for specimens. So um, basically, at the heart of these techniques is the analysis of the DNA in the sample. Specimens that can be analyzed could include blood, body fluids, skin cells, hair, and other body fluids that can contain DNA. So that's where that special tube and handling procedure comes in, because most departments in the lab, we don't see skin cells or hair. So they're going to have a different handling procedure than your normal specimens that you see. Standards and accreditation for the clinical laboratory. So Clinical Laboratory Improvement Act of 1988, or CLIA, you'll hear about them, so make sure you remember that, mandated regulations of all facilities that perform patient testing. And then you have the Clinical and Laboratory Standards Institute, or the CLSI, formerly known as the NCCLS, but now it's known as the CLSI. It established standards for laboratory procedures, and if followed, accreditation may be received. And then we also have to be accredited for Medicare and Medicaid reimbursement as well. So CLIA, going back to them, they mandate personnel standards for those doing testing and performs inspections to make sure that we are doing what we should be doing. Then we also have the Joint Commission. They accredit healthcare facilities, and they come every 2 years. They will come unannounced generally, so that you'll hear overhead, the Joint Commission is here, please help welcome them. And that's just kind of your heads up to know that there are inspectors in the building. And then we also have the College of American Pathologists, or CAP, which most laboratories are accredited by, and they inspect and accredit laboratories every 2 years as well. So once again, they are generally unannounced, and they come that morning, and then that that they're there. And if a lab is CLIA inspected, it will receive an exemption from a CAP inspection. It just kind of depends on the level of CLIA waiver or certificates, if they need to have CAP or not. Other healthcare settings for phlebotomists. So health maintenance organizations, or HMOs, are full service outpatient clinics with services under one roof. So a lot of those are going to be your doctor offices that we know now today. You also have preferred provider organizations, or PPOs. Those are groups of doctors and hospitals who offer services to employers. You also have urgent care centers, which provide walk-in services. As most of you probably know or have been to one, there are sometimes phlebotomists there that can draw and collect samples. And then you also have physician office laboratories, which send specimens to be analyzed at a separate reference lab, or if the facility is large enough, to an on-site laboratory. There are also reference laboratories that are independent labs that analyze specimens from other healthcare facilities or outpatients that are sent by providers. Nursing homes may also employ phlebotomists to obtain specimens from residents or analysis at a reference lab. And you can also potentially be employed at a blood donor service or a health fair. So like the blood center also employs phlebotomists.